Hello all, I am Mrs. Vinnie Matthew, nursing tutor, working with Oyster Nurses Academy, Kerala. We provide guidance for the prometric examinations to different Gulf countries: Saudi, Oman, Qatar, Bahrain and UAE. Today, we'll see about BATTEN disease. BATTEN disease or neuronal ceroid lipofuscinosis, in short we call it as NCL, is a group of fatal genetic disorders. The disorder affects the body's ability to get rid of cellular waste, that is lipids and proteins, so they build up in the cells all over the body. The build-up causes seizures, vision loss, problems with thinking and movement, and eventually death. Moving on to the types, there are 13 types of BATTEN disease. Classification of different types based on the age symptoms begin and the gene that has the change. Symptoms may begin in infancy, late infancy, childhood, or in early teenage years. Very rarely, adults can develop symptoms. All types of BATTEN disease are fatal except adult BATTEN disease. The most common type of BATTEN disease is juvenile BATTEN disease or CLN3. Symptoms of CLN3 usually begins between ages 5 to 50. Moving on to the symptoms, the first signs of BATTEN disease include vision loss, epilepsy, cognitive problems, problems with speaking, clumsiness, and issues with coordination, balance, and movement. Other signs appear later or they may overlap with the first symptoms. They include tremors, tics, muscle spasms, and abnormal muscle twitches, changes in mood, behavior, or personality, dementia, hallucinations, and episodes of psychosis, sleep disturbances, muscle spasticity and rigidity, weakness in the limbs which progresses into paralysis, heart problems such as arrhythmias. Moving on to the causes. BATTEN disease is a genetic disorder. It is inherited. It only happens when both the parents are carriers of the gene with a mutation. The gene that causes BATTEN disease affects the body's ability to break down and dispose of cellular waste. Lipids, sugars, and proteins build up in the cells all over the body. They especially affect the brain cells. The buildup causes the body to stop working properly. Moving on to the diagnosis. Diagnosis is by symptoms and family history. Then DNA test. A DNA test is the only way to confirm a BATTEN disease. Next is biopsy. There will be abnormally large collections of lipofuscins. Then eye examination. To check the health of the retina and optic nerve, electroretinography test is done. The test measures how the retina responds to the light. Moving on to the treatment, there is no cure for BATTEN disease. Currently, there is only one FDA-approved treatment. It is only for the children with CLN2. Children receive infusions of a medicine called cerliponase alpha every 2 weeks. The medicine is injected directly into the fluid surrounding the child's brain. The medicine slows down the loss of ability to crawl or walk. However, it does not slow down other symptoms of the disorder. Other treatments of BATTEN disease includes treating the symptoms of the disorder. Thank you. See you all soon with a new video.